New research from Washington University School of Medicine in St. Louis and the Veterans Affairs St. Louis healthcare system reveals a complex picture of long COVID's impact on health 3 years post-infection. The study, published May 30 in Nature Medicine, presents both reassuring and alarming findings. COVID-19 patients who were hospitalized within the first 30 days after infection face a 29% higher risk of death in the third year compared with people who never contracted the virus. This risk, however, shows a significant decline compared to the 1 and 2 year marks post-infection. Even those with mild cases continue to experience health issues 3 years later. The good news is that for those not hospitalized for COVID-19, the increased risk of death diminishes significantly 1 year after infection. This group, representing the majority of COVID-19 cases, sees a lessening of the virus's long-term impact over time. The study, which tracked the health of people infected with the original COVID-19 strain in 2020, assessed the risk of death and 80 adverse health conditions 3 years after diagnosis. Around 20 million people in the U.S. tested positive for the virus that year. We aren't sure why the virus's effects linger for so long. Federal data suggests that up to 10% of those infected with the virus experience long COVID. Previous research by Al-Ali has documented COVID-19's damage to nearly every human organ, contributing to diseases affecting the lungs, heart, brain, and various bodily systems. This new study addresses a critical knowledge gap in long COVID research, using a vast database maintained by the U.S. Department of Veterans Affairs. It included over 114,000 veterans with mild COVID-19. More than 20,000 hospitalized patients, and 5.2 million individuals without a COVID-19 diagnosis, ensuring a diverse representation through statistical modeling. 3 years after infection, hospitalized COVID-19 patients had a 34% elevated health risk across all organ systems compared to those who never had the virus. This is a decrease from a 182% increased risk 1 year post-infection and a 57% risk 2 years post-infection. Non-hospitalized patients experienced a 5% increased risk of long COVID in the third year, translating to 41 more health problems per 1,000 people. The primary systems affected were gastrointestinal, pulmonary, and neurological. Researchers also measured the number of healthy life years lost due to COVID-19. Non-hospitalized individuals saw a loss of 10 healthy life years per 1,000 persons 3 years post-infection, while hospitalized patients experienced a loss of 90 healthy life years per 1,000 persons. For context, heart disease and cancer each cause about 50 lost years of healthy life per 1,000 persons, with stroke contributing to 10 lost years. A mild SARS-CoV-2 infection leading to new health problems 3 years later is a sobering finding, said Al-Ali. A mild SARS-CoV-2 infection leading to new health problems 3 years later is a sobering finding. Some text goes here. The study's findings may evolve as data from post-2020, when vaccines and antivirals became available, is incorporated. It also does not account for the impact of later variants like Omicron or Delta. Even 3 years out, you might have forgotten about COVID-19, but COVID hasn't forgotten about you, Al-Ali warned. People may think they're safe, but the virus could still be causing health issues in the gut, lungs, or brain.